Okay, my name is Nicoletta Nestezakis, and I'm going to show you how to restrain a rabbit. This is my rabbit. Basically, we're going to take this scrap and we're going to hold their rear legs like this with one finger between, kind of hold them close to you so they can't get out. Or another way to do it is use the towel trick, which you could just wrap the towel around them and hold them close to you if you're doing like this, if you're doing like drawing blood from an ear or something like that. If you're doing like an IP injection, you would hold the hind legs up, put them in between your legs, and kind of put their head in between your legs and hold their legs up and do the injection through here. Okay, and then to do a physical examination on a rabbit, their heartbeat is actually pretty fast. Their heart rate's about 180 to 220, and their respiratory rate is 32 to 60 breaths per minute. And now I'm going to administer a medication. So to give oral medication, you just basically take like a syringe full of, whatever fluid it is. If it's, pill pockets, you can use a pill popper like you do in cats. You could just open their mouth and stick it in your finger down, but that's not the best way to do it. Or you just take a syringe if it's liquid, draw it up, and elevate their head and stick the medication down their mouth. To do to get blood, you can get the blood from their ear. You can just get some alcohol on a cotton swab and just swab the section where you're going to get the blood draw. Obviously, they need to be restrained at this point, and the towel is the best way to restrain them. And then pour some alcohol on a cotton swab. Alcohol the spot. You can shave the spot as well and scrub with Clorox scrub with alcohol, especially for like a catheter. And you just basically inject the ear. And always draw black to make sure you get blood. And if you don't get blood, like if you get air, obviously redirect your needle until you get the blood, and then just draw back, and then remove the needle when you have enough of your sample. Hold the ear so no hematoma forms, and then you just insert it into whatever test tube you need. To do an IM injection, you can do the lumbar muscle near the spine. Obviously, the tail will be restrained like everybody else. So that will be restrained, and basically what you do is you just take, I use my index finger to touch their spine, and a middle finger touch like the side of their, I would say like the last rib or so down there, just so you section off the muscle. And if I'm giving an injection of Medicam or something of that sort, Torbilix or butorphanol, I feel to make sure that it's soft, that I don't feel like bone or anything like that. I go ahead and, so let's say I'm giving, 0.2 Torbilixer, I go ahead and inject it, and usually they'll flinch, especially too that you're there. You aspirate to make sure you don't get blood, and then you go ahead and plunge the medication through. You can also do the quadriceps or the caudal thigh, you alcohol the area. You can actually shave the area if you like. Some owners don't like that. So you just alcohol the area, and you go ahead, and obviously it would not be the same needle. It would be a different needle because it would be different medication. And so you hold off. You could have somebody, if you're drawing blood, or I would prefer preferably the ears, but if you're giving the medication, you don't hold off. You just hold the leg tightly. This whole pet is restrained. Pet is usually restrained, and you could just have, you have the pet restrained like this, and you could have the limb out. And then you go ahead and you can give it the quadriceps, or the femur, the caudal thigh, and go ahead and give the injection, aspirate to make sure there's no blood, and then go ahead and give the injection. You want to make sure to not get the sciatic nerve. And then we're going to go ahead and clean and medicate the ears. We're first going to get an ear swab cytology. So I have a side already ready with right and left, 2 Q-tips. I go ahead and I go down to the ear canal, I roll it and come up, and what I'll do is, that was the left ear, next to the left section, I'll just roll the yeast or whatever it is on the slide. I usually break it left, so I know that the left is shorter. Go ahead and do that to the right ear. Go ahead and slide. Okay. And then we can clean out the pet's ears. Obviously the pet is completely restrained either by another restrainer or covered. Like this. And then, so we go ahead and we can pour the Chlorhex flush, and you kind of hold the head for the Chlorhex flush down the ear, cover it, massage it through. What we tell owners to do is the cotton method, where you fill the cotton up with the medication and you go ahead and just squeeze it down the ear canal. Cover it, massage through, and then let the pet shake. Then you go ahead and you clean it out with gauze, clean it out with Q-tips until you get all the debris out. And then we go ahead and we take the slide and we stain it with our stain, and he fix it, and then the doctor will read it, or the technician will read it. And sub-Q injections go usually in between the shoulder blades. So again, we would get a new needle. Get a new needle, and let's just say it needed like again, Turbolix injection or butorphanol or buprenorphine. You just go right in between the shoulder blades and kind of a diagonal, aspirate to make sure you don't get any blood, and then you go ahead and plunge. You kind of hold it flat. And then, oops, what was that? So I think, and then how to differentiate the different male and female. Clearly you won't be able to tell on this. So I took out a picture, and so the female with the males, you can actually push down. You have to push down right above their penis area, and you ever so slightly in the end of their abdomen, you can push down here. There'll be 2 testicles here, and you push down, and their penis will actually retract. Perfect. And retract, and then so you'll see this is a male, and this is their scent glands, and this is their penis. And with the female, they have like a slit-like vulva area, and it'll be visible if you just push the hair back and you look. It'll be visible. And obviously the males will have 2 testicles, and their penis will retract just with a little push, and the females will have a slit-like vulva area. Okay. And I think, and that is it. So again, I went over the recovery of the anesthesia. Went over that in the other video. That basically, when we have them intubated, we usually have them swallow 3 times before we remove it, and then we extubate. And you put them in a quiet, dark area, monitor them with a heating pad, and that's it. Okay.